Huh. Hello everybody, my name is Jaslyn Hawkins and I will be presenting our final capstone project. My capstone project is Overcoming Childhood Obesity Through Nursing Education. The healthcare issue this capstone project is covering is the significance of childhood obesity. It is crazy to learn that 14.7 million US youths aged from 2 to 19 years old are in the category of obesity. This is very relevant because what seems like a minor problem at the beginning of a lifespan can actually follow someone to their adulthood, which causes more severe issues such as diabetes, cardiovascular diseases, and even cancers. It is also interesting to know how much of an impact the parents have on their child and how the nurse in their school or even primary care can use their educational scope of practice to educate children and families on ways to eat healthier and be more active in order to prevent childhood obesity. This is significant to nursing practice because nurses should always strive to utilize their scope of practice for as many benefits as they can. When formulating an intervention plan for a proposed issue that can be occurring amongst a community, it is important that the researcher stays focused and organized. One way a researcher can remain focused and organized during their research and interventions is by completing what's known as a PICOT question prior to the initiation in order to gain clarity on their goals. The P in this acronym is population. Who is the population or patient group of interest? The I stands for interventions. What intervention or action are you planning to implement or examine? The C stands for comparison. What is the alternative or comparison group, if there is any? The O stands for outcome. What are the outcomes you are hoping to achieve? Finally, the T stands for time. What is the time frame for assessing the outcomes? My project involves the concept of childhood obesity and how I believe school nurses can promote healthy interventions in an attempt to reduce the rate of childhood obesity amongst their community. The concise research question would be, what is the effect of a nutrition education enhancement led by the school nurse on childhood obesity rates among school districts over the course of one school year? The population of my topic is children in school. The intervention would be nutrition education enhancement led by the school nurse. The comparison for this topic could either be comparing the outcomes to the current scope of practice and duties of a school nurse and their impact on childhood obesity, or no comparison at all. This would be comparing the outcome to no intervention. The initial PICOT question can help gain an idea of what will be researched, but having a concise nursing research question will help enhance the time it will take to accomplish the desired research. My nursing research question is, what is the impact that education has on childhood obesity? This is very clear and straight to the point. Once there is more information found on this topic, then we are able to correlate it back to why it should be part of the standard for school nurses to perform these educational interventions. This question aligns with my project goal of finding evidence to just that and inspiring school nurses to spread awareness and prevent disease. The main issue that I wanted my capstone project to cover was childhood obesity, and in this chart we can see the increase of its prevalence along with ages. Understanding and accepting this is an issue that needs to be addressed is also one of the first steps of the capstone project. The purpose of this project is to promote the nurse's scope of practice of education in order to implement nutrition and physical activity awareness among school-aged children. This can hopefully be done by school nurses across the country. The main objective of my research was to see how many children have obesity, how much education is already given to these children, and the impact education actually has towards children's perspective of nutrition and physical activity. My intervention of promoting education amongst nurses will help children understand why it is important to make healthy decisions and have tools to rely on when making these decisions at school and at home. There was a study done from the year 1999 to 2018, which analyzed the body mass index, also known as BMI, for children and adolescents. Unfortunately, there are health disparities that are present. There are ethnic variations. This is what it states. The prevalence of obesity was more than 20% in children of Mexican American, other Hispanic, and non-Hispanic Black children origin in 2017 to 2018, compared to the 16.1 in non-Hispanic white children. Knowing the existing health disparities exist can help me target a specific intervention, such as a target population and the importance of education in that community. Since there is a health disparity, there might be a lack of care in those communities and lack of education. Nurses in those communities should be able to provide the educational gaps to their patients and make it one of their priorities in order to prevent childhood obesities. This was the main key literature that helped shape my research approach. When researching childhood obesity and its importance to a child's health and well-being, it is important to identify a nursing theory or model. The nursing theory I chose for this research design is Dorothea's Oren's self-care deficit nursing theory. This theory emphasizes the importance of individuals' ability to engage in self-care in order to maintain their health. This theory aligns with my project's focus by ensuring school-age children are receiving the education needed for them to be able to take care of themselves and make healthy nutritional choices. Children are capable of making good decisions for themselves when they are made aware of risks and benefits when doing so. The most appropriate research design for my study covering childhood obesity is a qualitative approach. I want to do a qualitative research study on the students' perception of their own nutritional knowledge. For example, this would be the question that I would ask. How important do you think nutrition is for you? How important do you think physical activity is? This will get a baseline on how the students feel about their health. This will be done in a selected school district. One of the strengths of qualitative research is its ability to explain processes and patterns of human behavior that can be difficult to quantify. I was initially thinking of doing a quantitative approach and having their body mass index measured from baseline to their end of school year, but I feel like this can cause ethical disruptions such as body image disorders and bullying amongst its students. Considering the feelings of school-age children is a challenge I encountered during this design, because although I am passionate about the health and well-being of children, I'm also passionate about their happiness and mental health. After conducting an experiment on a research question, it is time to review the results and/or the expected outcomes with a discussion covering the topic. Before getting to the expected outcomes, we should review what the proposed plan was and the original research question. The original research question for my project was, what is the effect of a nutrition education enhancement led by the school nurse, as mentioned earlier? This research question is important because it directly correlates to the health and well-being of children. When their nutrition is taken seriously, we are able to optimize health and hopefully get them to the place of health and wellness that can follow them to their future adulthood, and the desired results includes increase in knowledge of nutrition and physical activity. The plan for this research question was to collaborate with a school nurse in order for them to perform quarterly seminars covering nutrition and physical activity. These seminars will be tailored to catch the engagement of children of all ages to high school students. The plan is to collect qualitative data by way of performing a survey prior to these seminars in order to discover their baseline knowledge and interest in their health, and then perform a post-seminar survey in order to compare the results to the pre-seminar survey. This was the plan in order to remain ethical and not have children fixated on their weight, which can potentially cause issues with self-image and bullying amongst peers. The expected outcome for this experiment is for children to be more aware of their nutrition and physical activity and think about their food choices throughout the school year, and hopefully carry this knowledge with them as they are growing up. These are the theoretical projections. Enhancing the knowledge and care of children's nutritional values directly correlates with the research question mentioned above, due to the fact that it is increasing their knowledge, with the goal to decrease childhood obesity. Insights into implications for practice include making health a priority amongst children. Children are already getting optimal attention from preventative health care by way of vaccines, so it is also important to view non-communicable diseases under the same light, such as diabetes, cardiovascular diseases, and other obesity-related diseases. Future research project expansion includes test trialing these seminars across the country of the United States and comparing results. There would need to be a lot of funding in order to have the nurses and resources available to accomplish this, but if the nation prioritizes this, then it is able to be accomplished. This also involves a team effort from families, teachers, and public health nurses, as well as physical education instructors. Just like any other study being done, there are limitations. The limitations to the project design that I proposed would be trying to remain ethical. It would not be ethical to have children focus on their weight all year and potentially compare themselves to others, which can include behaviors of bullying. Yes, children should be educated, but they should also be able to enjoy being a child without the fear of being obese. Their health is the responsibility of their parents, so it is important that their families at home are also being educated on nutrition and physical activity. Overall, this capstone project highlighted the important role school nurses can play in early prevention strategies and proves how impactful educational interventions can contribute to someone's health long term. Education is a huge, underrated intervention that is under the scope of practice of nurses, and nurses should really utilize it a lot more than they do. The general population really respect nurses and trust what they have to say, so it is important to use their power for good and make a positive impact, especially towards children. Although educational interventions are very helpful, it is still critical that nurses must approach obesity prevention efforts with sensitivity, cultural humility, and trauma-informed communication, which will ensure students of any age feel supported rather than judged. Mental health is just as important as physical health, so being mindful about the way the message is being delivered is crucial from the nurse's perspective. When nurses create a supportive, non-judgmental learning environment, they can influence physical health as well as self-esteem, resilience, and health literacy among children who are growing and thriving. School nurses make a difference and have the opportunity to make an even bigger difference. And these are the references. Thank you.